ill, frustrated, and desperate for relief. A young man finds himself switching between two drastically different moods, and he longs for help. When his mood is elevated, he delights in impulsive decisions, but then he enters a depression, dark and somber, reflecting a valley that no man dare pass through alone. He cries to God, asking for help, feeling lost as if in a whirlwind of despair and loneliness. Helpless and on the brink of suicide, he aches for a solution. After visiting a doctor, he is told that he suffers from an illness called rapid cycling bipolar disorder. He is prescribed a low dose of lithium daily with the explanation that this will help stabilize his brain chemistry and slow his ever-changing state of mind. After a few months of treatment, he gains a greater control of his emotions, and he finds the courage to visit his church for the first time. After the service, a pastor explains to him that the use of psychiatry is simply a lack of faith, and that by repenting of his sins and asking the Spirit for help, he can find the path to spiritual wholeness. The man knows some aspect of this to be true, but questions the validity of stopping treatment as an act of faith. Devastated, the man is faced with a choice. He thinks to himself, should I stop the well-progressed treatment altogether and risk a return back into mental instability? Or should I continue the treatment but lose the approval of my pastor? My question to you would be this: why must the young man choose? Shouldn't there be harmony between the brain-stabilizing medication and the wise counsel of the church? Since the fall of man, humanity has experienced the entrance of disease into our world. We now live with illnesses as a consequence of original sin, which affect our bodies and our souls. One of these is bipolar disorder, an illness where patients experience fluctuations between depression and mania. Depression can be described as a sense of misery and hopelessness, accompanied by various symptoms, including drowsiness, anxiety, loss of interest in daily activities, and depressing sadness. And all of these can reach an extremely high suicide rate. In contrast, manic episodes can be characterized by a sense of euphoria and extremely high self-esteem, accompanied by a high energy. Patients may feel that they can accomplish anything on an unrealistic level due to a faulty self-knowledge. Physically, they experience racing thoughts, agitation, insomnia, and they can tend to fall victim to substance abuse. Within this disease, there are various types of cycling patterns, which dictate the speed at which the patient fluctuates between depression and mania. And without treatment over time, this can worsen. Carried within the genes of the patient, this disease can develop at any time within their life, but it is usually triggered by a tragic or unexpected life event. Dr. John Carr Zubieta and his colleagues performed a study through molecular imagery that proved that patients with bipolar disorder have a lack of natural serotonin within the hippocampus of their brain. What this means is that patients with bipolar disorder show an unnatural response to the emotional stimuli, thus causing the imbalance of emotions. Let us now turn from the medical facts of bipolar disorder to a cultural history of biblical counseling. In the 1950s, J. Adams, a professor at Westminster Theological Seminary, saw the uprising of psychology and called it a religion of its own. He saw that bipolar disorder is not an issue of brain chemistry, rather that it was an issue started within the evil roots of a man's heart. John MacArthur followed him in his footsteps for precisely the same reasoning, and he delved into the realm of biblical counseling. Rather than viewing bipolar disorder as a chemical and genetic disorder, it is viewed as a natural result to sin. MacArthur explains that tampering with the human state of mind sets off the ideal balance of human nature. While a lack of faith will not benefit any person who suffers, it is an unsupportable claim to say that these medications conflict with God's will. My hope is that at the end of my presentation, you will better understand my position behind psychological medication, and that you will increase in your compassion for those who suffer from bipolar disorder. I strongly believe that the church should understand and accept the use of psychological medication for those who suffer such an illness as bipolar disorder. It is our Christian duty to provide comforts for those who need comfort, and to provide hope for those who are suffering. Without treatment, this illness will spiral and it will worsen. Though some physical side effects may arise through the use of the medication, it is arguably better to have the sanity of a person restored than to have someone spiraling out of control from unstable emotions. The Bible tells us in Genesis 1:27 that we have been knitted together wholly and completely by the wonderful hands of our Creator. As you know, God created us in His likeness. But as a tragic result of the first sin, disease and illness now wage war against our mortal bodies, blemishing what God had originally intended for His creation. Now, with the illnesses that surround us, we should, within human limitations and by God's good grace, strive to turn this chaos into a more orderly function. It is within this context that we should understand psychological disorders. Through our responsibility to uphold our Christ-likeness and our responsibility to care for creation, we should strive to rebalance the imbalance that bipolar disorder is. Although the brain is connected to our reason, which makes us God's intelligent creation, it is still a physical part of the body that can get ill and that can endure treatment. God gave our brains the ability to direct everything that we do, feeling, loving, thinking, praising, and so on. So why would one refuse medication to the brain as if it is not a physical part of the body? Do we leave a sick man whose brain is ill with cancer to mend his own? No. We treat cancer with chemotherapy and radiation the minute it is diagnosed. If we can treat cancer, then we can and we should treat chemically caused psychoses, such as bipolar disorder. Further, the Roman Catholic Church has provided sensible teachings on treating mental illness that all Christians would benefit from learning something from. They explain that God has given us all natural abilities and talents to use to glorify His will. Some of these talents include researching, understanding, and creating medical advances that help the human well-being. Under this category would fall psychological medication and their application. With the natural resources in God's world, why would we refrain from such discoveries? Perhaps by applying these medical advances, we will fulfill our spiritual and physical purposes for healing. Within the Christian community, the strongest anti-psychiatric group relies on the perfect image of God to be the example for all earthly conflicts. MacArthur argues that being Christ-like is to be victorious in suffering. He mentions that Jesus survived on earth without committing one sin, and that we as Christians must follow his example in all that we do. I agree with MacArthur that we should imitate the image of Christ in all that we think, say, and that we do. But those who suffer from psychological illnesses are not completely able to accomplish this in many respects. While we know that God allows suffering in our lives, and that some healing can be redemptive, we also know that God delights to heal and that he has given us the resources in his world to learn to heal with medicine. The question then is, why would we withhold medicine from mental suffering yet provides some medicine for those who are physically suffering. Psychiatric medication has been proven to help stabilize brain chemistry, but those who suffer from bipolar disorder require much more than neurological stability. The church should be responsible for the counsel and the direction of the human well-being and the human spirit. Wise counsel from well-trained and good-hearted Christians should not be discredited, because all who are ill and all who are healthy need to focus on their human well-being. It is so important that those who have bipolar disorder not only receive the needed medication, but also focus on their personal relationships with Christ. Counseling and medication should work in harmony, because stabilizing the patient both physically and mentally would be for the best possible outcome. God explains that we shall not withhold the blessings that he has bestowed upon us, rather give them to those who are in need of love and who are in need of healing. 1 John 3:17 states, "But if anyone has the world's goods and sees his brother in need, yet closes his heart against him, how does God's love abide in him?" As men and women who are created in the image of God, we have a responsibility to care for ourselves, for one another, and to care for God's creation. It is crucial to understand that the brain, like every other vital organ in the body, can suffer illness and can endure treatment. God has given us the means by which we can create medication for the restoration of brain chemistry. Yet fellow Christians in our community are crying out, aching for the remedies that we have been given. Brothers and sisters, I ask you to encourage and support those who require medication for such a mental illness as bipolar disorder. And may we, in doing so, fulfill our calling as Christians to love one another just as Jesus has so graciously loved us. Thank you.